Test 1, 2. 1, 2, 3, 4.
Test through Zoom. 1, 2, 3. We're ready to start. Whenever you're ready, Margaret, you can go.
Hello, everybody, and welcome very much welcome to this end of year press conference about Ukraine, another winter of war. We've got with us somebody who probably needs no introduction, Dr. Yana Yakovenko, who is our country representative in Ukraine and has been through, was there before the war and has been there all throughout, and he's going to give us a briefing on this subject. So without further ado, over to you, Yana, joining from Odessa.
Thank you, and good morning, good day, good afternoon to everybody. My name is Yana Yakovenko, and I'm WHO representative, and welcome to the end of the year briefing, which we as a WHO thought it is valuable to do, to tell about the public health and health system about Ukraine, as well the humanitarian response, which is ongoing. And two key messages that we have really in the beginning is, one, we are entering to the second winter, which will be a cold and long winter and has also public health effects. And the second, what we have seen since 24th of February 2022 and Russian Federation invasion and its impact to health and public health, we see the increasing disease burden. So even if the war would end today, the health needs of people, millions of people across the whole Ukraine, will be high and increasing. And let me bring some of the examples, as I have been traveling across Ukraine month to month over the last year, being in almost all oblasts, looking to health situation, talking to the brave healthcare workers. But in the past few days, I had the chance to be especially close to the front line and talk to the healthcare workers and people about their needs and check the reality. Together with Viktor Lyashko, Minister of Health, we were in Liman, where during the stay there, only a few hours, we heard constant shelling. And that's the reality where the healthcare workers need to work and patients need to receive care. And there are living 12,000 people out of those 600 children. And we as a WHO, together with Ministry of Health, delivered critical equipment to ensure that the laboratory tests can be done, as well the medicines, so treatment can be available through this winter that I referred to. I continued to Kherson Oblast, where the area was regained in October, November last year. And the disruption of health system is high. And while we were optimistic last year that restoring health system can be fast, it takes time. Together with the Deputy Minister of Health, Sergei Dubrov, we opened a center that allows the emergency care workers to provide care, and especially in the winter conditions when it is difficult to drive around. And I can tell in the past 4 days, traveling more than 2,000 kilometers, Ukraine is a big country, and we need to think how to reach to the civilians to provide care to them. And that center really ensures that we can provide care and healthcare workers can work further there. And these are just few examples. As a few days ago, we delivered already ambulances. And this means that WHO has delivered all total together 115 ambulances to ensure that the care can be provided and access can be provided and inter-hospital transport is available. But also this morning in Odessa, where I am talking, I had a chance to talk in the burn center with the healthcare workers as well patients. And we have witnessed increased number of burns related to heating and the new heating devices, because since the attacks to the civilian infrastructure, people need to find ways to have electricity and heating, as well to talk about the increased burn needs because the attacks with drones and many civilians who have suffered. So the needs are now here, and the needs will be there as we are entering also to 2024. So this is the key message, and looking through our experience as the World Health Organization working across the whole Ukraine. Let me now bring a few of the elements, and I will talk today about humanitarian perspective in 2024, looking particularly to health. I talk about long-term needs, which are related to the rehabilitation, physical rehabilitation, and mental health. Third, I would like to highlight aspects related to recovery. Fourth, small aspects related to the transformation and health systems, why we are seeing so much of the health system functioning in Ukraine after 22 years of full-scale invasion. And the last, I would like to reflect slightly how the EU accession can be catalyst also to transform the health system further, and particularly public health services. So let me then look to the humanitarian part. We see that the humanitarian need will be continuing in 2024 and in the same level as now. However, it needs to be more focused to the oblasts which have highest needs in East and South. As WHO and health partners, we have evaluated that health needs, people in needs, next year, 2024, account for 7.8 million people. And we as a humanitarian community working in health and with WHO coordination are targeting 3.8 million people. And this is something where we need to put all of our effort to reach to all of those civilians, many of those who are elderly and children, some of them smiling, cycling when I have seen them in the villages, but some of them really suffering and struggling as going through the winter, as well going through the war. Now, why this situation persists? First, we have observed numerous attacks on health. WHO has verified more than 1,400 attacks where many civilian casualties are present. And these attacks continue. That's why that poses also risks to provide health services. Second, when we look to the health facilities, what we see that numerous health facilities are not either fully functional or partly functional. For example, if you look partly damaged health facilities and their share in Kharkiv, 21% of health facilities are only partly functional, while the rest are still working. In Mykolaiv, 18% are partly functional. But if we look fully damaged facilities, this counts 6% in Kharkiv and 14% in Donetsk Oblast. So in those places, it is very difficult to provide services, and we need to consider what other means we have available. And when we look to the access to care, we see in particularly access to care is difficult where the humanitarian needs persist. So we have attacks on health, we have facilities which are damaged, and also we are looking that we need to have ensure access because civilians say they don't have full access. What we can do is support Ukraine. WHO, since 24th of February 2022, has delivered almost 4,000 metric tons of medical aid. It includes ambulances, medicines, equipment, oxygen. It's a long list. And that long list will persist also next year as we need to support. However, it is also important to notice that there are numerous partners and also government ensures that humanitarian support is available. But we need to be complementary and continue. And this humanitarian aid is delivered by WHO to the individual facilities. We are working with more than 1,000 facilities across Ukraine, but also together as a whole UN. We have United Nations interagency convoys where WHO is participating. In the first 100 convoys we did, WHO was present in 85, and we continue to be present because health needs are high. Second, we need to look to the restoring the facilities. And that's why the modular units I was referring for the emergency medical services, but WHO has also installed 12 modular units for primary health care, particularly in Kharkiv Oblast, but also in Sumy and others. And this is important to ensure that there is a safe place where people can come and where the healthcare workers are available. And in other sites, the primary healthcare outreach is important to ensure access to chronic care, and this is what we need to do. And to make all of that available and happen, WHO is continuing to do trainings on mass casualty, addressing the non-communicable diseases, etc., because we need to make all the healthcare workers aware of needs and practices. But what makes me a little bit happy in this environment, I see that majority and many healthcare workers have gained the trainings over the last 22 months. So humanitarian needs will be there. There is clear reason as the war is ongoing why the needs are there, and we know what to do, and this needs to continue. Let me come to a second topic, which is long-term needs, and particularly mental health and rehabilitation. In rehabilitation, we have been working together with many partners and hospitals to ensure that the modern rehabilitation is available. And war has been a catalyst of this change, but we need more, and there is need to ensure that the centers are available, and particularly the challenge for the coming years is to train enough specialists, from ergo to physiotherapists to the doctors, to ensure that the care is available, because needs will be there for the long term. And in mental health, we have more than 10 million people with a mental health needs. It can vary from simple stress, anxiety, to the other high-level needs in that you need to turn to the primary care and hospitals. What we have been doing is to ensure that the training materials are available for people, like the Self-Help Plus tools available in Ukrainian, and with the leadership of Olena Zelenska and the all Ukrainian mental health program, much has been done. And we should ask, how are you? More often from each other, and this is happening. But also more than 55,000 primary healthcare workers are trained on mental health, and the community mental health teams are available across the different oblasts. So the care is to be scaled up. But what I wanted to say, and why bring mental health and rehabilitation here, because these needs will be long-term, and these needs, particularly mental health, will be for many generations. And we as a public health community and the overall community need to ensure that we address that properly. And I like to thank many of the partners, many of the volunteers, many of the professionals who are working on mental health and rehabilitation. The third I promised to cover is recovery. And I just want to mention here that on recovery, we see numerous positive developments. The pharmacies have been restored, the primary care centers have been opened, and this needs to continue. And this is something that I have been observing over years here, that recovery starts now. And that is to continue also in 2024. Now, the fourth topic is about transformation to system, and the system to be resilient. Here, I would like to highlight the courageous doctors and nurses are continuing to provide services. The health system is functioning. 2023 is a year where Ukraine addressed and closed the polio outbreak. That means the public health system is functioning and progressing further. But this needs to continue. And for this, what is very, very important in an environment where we are is continuous budget support to Ukraine, particularly ensuring that the social sector is supported, health, education, social sector, because that allows Ukraine to progress and move forward. And that allows the humanitarian response to be more focused while the country is transforming its health system further. And this transformation is important also for people because we need to ensure that access to care is free of charge. And we see that because of the poverty levels are going up, people have more difficulties to access the care. Every fifth person delays the care because it is not affordable. So we need to ensure that the health system also transforms across the country, not only in the east and southern oblast, to ensure access to care. And this contributes later to the better health as well-being. And finally, let me stop for EU accession. As a public health community, we look into that as an opportunity. Ukraine has adopted during the wartime the new public health law, progressing with surveillance systems, ensuring that the public health specialists are addressing also risk factors like non-communicable diseases. And now with a potential that the negotiations are moving forward, the potential is huge for the public health to ensure that point by point, improving the public health system will improve also people's health. So I'm looking optimistically to 2024 as country, as well as the healthcare workers, as well the institutions are to be resilient. And this gives me a hope as we are moving forward. But as a WHO, I plea also to many of the partners and many of the colleagues that we continue the support. And this is because we know clearly the humanitarian support, where we need to reach 3.8 million people, and financially it means similar support as before. We know that rehabilitation and mental health needs are there for decades and generations. We know that recovery is possible, and Ukraine's health system and many of the partners from public and private sector have shown its possibility. We know that transforming the health system has kept the trust in the system and has allowing Ukraine to respond, because much of the response is delivered by Ukrainian doctors and nurses in the front line, and across the country, the health system is moving forward. And we see that EU accession, and particularly the aspects related to public health, are opportunity to transform the system even further to deliver better care for Ukrainians. So thank you, and back to you, Margaret.
Thank you, Yana. Thank you, Dr. Habicht, I should say. So now I'll open the floor to questions. I will start with the room. I don't see any hands up yet, but please put your hands up online. Christian, do you have a question? No? Looks like you've been really comprehensive. Jamie Keaton's got his hand up. Jamie, please go ahead.
Hi, Dr. Habicht. Thank you so much for coming to see us. I wanted to just see if you could elaborate a little bit more about the impact of European Union accession of Ukraine to the health system. What specifically kind of can you see as an impact of that, and how would it be transformative for the country?
Thank you. And there are many points there across the acquis and the negotiations to start. But few aspects I would say. One is really that we have more harmonized disease surveillance together with the EU member states. That's very important for public health and also information exchange. The second, also it is opportunity to ensure the medical education is more harmonized, and for many of the nurses and doctors to have this opportunity. But also there are a number of aspects related to water, sanitation, many of the standards that will transform actually to better public health. So it is a comprehensive approach that allows Ukraine to have a better environment for many people. So in that sense, I'm optimistic, but also I'm realistic that these changes will take time. But if we start today, then we feel those changes after some of the years. And in that sense, it's a very important signal for public health community that we can transform, and we need to transform the reforms further.
Thank you very much for that answer. And now we'll go to Yuri Aprilev of RIA Novosti. Yuri, please unmute yourself and ask your question.
Yes, thank you for taking my question. During your speech, you mentioned mental health and that this is a problem in Ukraine right now. How many people are we talking about, and what is the risk that the soldiers will return from the front with unrest and be dangerous for society, as we saw in the local parliament of Zakarpattia, where a deputy detonated 3 grenades in the middle of a meeting? Thank you.
Thank you, Yuri, for the question. So as a WHO and learning from the previous conflicts across the whole world and looking to the data of Ukraine, we see that the mental health needs are around slightly more than 10 million people. And this varies from different conditions. So I think that is what we see ahead of us. And that needs multiple approaches, as I mentioned, various tools for the stress management, ensuring that the primary health care is available. And there we have been doing trainings on MHCAP tools, which ensures that the nurses, doctors, and many of the professionals are trained on mental health. As well, we have a mental health teams available, many of them with whom I have been meeting in Kharkiv, Vinnytsia, as well in other cities over the past year. So this is what Ukraine is transforming to, is to have multiple approaches to mental health, from self-help to the professional support. And this is something ahead of us. Now, returning of veterans is something that also has been much discussed to ensure that the services are available. And this is a topic that needs continuous attention to support everybody. So that is what is ahead of us, and that's the reality also we have.
Thank you very much for that answer. The next in line is Lisa Schlein. And Lisa, before you ask your question, I'll assure you that the notes are coming. They're being generated as we speak, and we'll have them out to you in about 30 minutes. But over to you to ask your question.
Oh, God, you know me so well, Margaret. It's scary. Thank you. Dr. Habish, nice to see you. I do have a few questions, however, which may not be in, the answers may not be in the notes. Anyway, I would like to know, support, unfortunately, seems to be waning for Ukraine. In my own country, the United States, among certain people, and in Europe, so forth. And that means that the weapons needed and the money needed for humanitarian needs and health needs like your own might not be there. How much money do you actually need? And is this a matter of concern for you? Then I'm wondering about the situation of access, whether you are able to reach people in all areas of Ukraine. Many, as you mentioned, are hotspots in terms of the armed conflict, and also whether you have any access to areas that are currently under Russian control. And then thirdly, what are the both infectious and chronic diseases that concern you the most? And in particular, winter is here, even here in Geneva, amazingly. What are the biggest concerns for you? Will you be able to reach many people, or will there be a significant number who will be out of your reach and might be at great risk of disease and of death. And if you could speak, so sorry about this, but if you could speak specifically about the situation of children and how they are faring. I think you mentioned there were, I don't know, 600 or no, a lot of children. I don't have the numbers. Thank you.
Thank you. And thank you, Lisa, for the questions. So let me take, there were 5, if I counted them rightly. When we look to the support, then first of all, I like to thank all the international community who has supported the World Health Organization, but also other organizations, because the support for the humanitarian response, as well the development, we have really in 2023 reached to our goals, and the support that has been through WHO, which counts almost $100 million in Ukraine, has been saving many lives, and we have reached to 8 million people. So I like to first to thank for the support in 2023. But for 2024, we see that the needs are in the similar scale for the humanitarian response. As well, we need to keep the development support ongoing. But what is particularly important for the social sector and health sector, including, is the budget support, because we can be more targeted in our humanitarian support as a humanitarian community, as the development community and the budget support is also available to ensure that Ukraine healthcare workers have their salaries and the system is moving forward. And this is particularly important when we look to the budget 2024, where much is dependent from the budget support. So for all who are following the war in Ukraine since Russian Federation invasion, the solution has been until now that we have the budget support, we have the humanitarian support, we have the recovery support, which is growing slightly, and we have also all the development support. So in all the areas, the support has continued. And that has allowed Ukraine system to be resilient, and that has allowed actually Ukraine to lead the response, while the humanitarian and development community is complementary. So I ask everybody to consider, as we are going also to 2024, that these multiple ways how Ukraine has received support will continue. And that would allow also the health system to provide essential services to those in need. The second, in the front line, while being in Liman, our team is every second day in the frontline communities. We continue to deliver medicines there because the reality is that many of the pharmacies are closed, and in some places the doctors and nurses are not available daily. Liman is very close to the contact line, approximately 10 kilometers. We heard shelling every hour where we were there. We passed numerous minefields to reach there, but also we saw the strength of the healthcare workers who are providing continuously the services. So to the frontline areas, the humanitarian community is doing utmost to ensure that the medicines, equipment is available, and when needed, we are supporting also with the healthcare workers. Like after the Kakhovka Dam explosion, we have been supporting hundreds of healthcare workers with additional incentives to be available to provide services, surgeries, anesthesia, as well chronic diseases support I am coming to. The third question about access to occupied territories. Unfortunately, we don't have access to the territories, and this is something that we have been also asking together with Denise Brown as a humanitarian coordinator also in Ukraine. Now, coming back to the chronic and infectious diseases, let me start from infectious diseases. Currently, the surveillance system shows good resilience of Ukraine system. We don't have major outbreaks across the country. We have been following up the hepatitis A outbreak that was in Vinica, and we need to continuously ensure that the surveillance system is there. And as I mentioned, the polio outbreak has been closed, but one particular area that needs attention is continuously ensure the vaccination and to ensure that vaccination and other services are available for internally displaced people. Because in addition to millions of Ukrainians who have left the country, also within the country, we need to ensure that IDPs, internally displaced people, have access to care because their access is slightly lower in the new places of living compared to the residents who were living there before. And the vaccination is particularly something which is ahead of us, and we need strong vaccination outreach programs also in 2024, in the same way as we have been doing and supporting in 23, including the vaccination for elderly and children. On the chronic diseases, as a last question, if I remember all at once, the situation is complex. And particularly, we need to start to pay attention much more to the non-communicable diseases. Here I mean the pulmonary diseases, here I mean with pulmonary diseases as lungs, as well the acute myocardial infarction and stroke. And here we need to ensure early diagnostics and availability of services. Let me bring an example. When I was in Poltava a few months ago in the rehabilitation department, we had numerous men and women, mainly men, who had turned to the doctor later. And after they had stroke, it took time to learn again, to speak, to write, to walk. And these aspects are avoidable. But in the wartime, access to care, especially for the chronic diseases, might be delayed. And here, if we compare the COVID time, when many countries were struggling with the chronic care and ensuring that the essential services are available for everybody, then here we need to pay attention to this. And this is very good question and aspect we need to address. And what I said in the beginning is that we will see the disease burden continuously increase. And the disease burden because of the chronic diseases, infectious diseases, mental health and physical rehabilitation needs. So the health needs are there. And we need to continue to support, and this is what WHO does also with the team across the country. Back to you, Margaret. And Lisa, I hope that I covered all the questions.
Lisa's still got her hand up again, so I think there's a follow-up. Go ahead, Lisa.
Yeah, it is. I mean, you're really great that you got, I'm so sorry to bludgeon you with all of these questions at once. It's because of the remote area. I feel as if I don't get it all in one gasp, I won't get it in. You did not answer a couple of things, however, and that's my fault, not yours. And one was, if you would specifically talk about the condition of children, how many are at risk, whether malnutrition has gone up considerably, whether many are at risk of dying if they might not get the treatment that they need, and also specifically your big concerns for the winter, which is here now, especially as Russia is likely to attack the power grids, and so the kind of heating, electricity, other needs that are vital will be knocked out, how you're going to work around those situations. And thank you again.
Thank you. When it comes to the children, then of course the impact of war is devastating to children. And this many have seen since the beginning of the full-scale invasion. This has impact to mental health. This has impact to nutrition, as you mentioned, as well the vaccination. So we need to ensure that the comprehensive package is available. And there we have many of the partners, including UNICEF, who is ensuring that there are outreach services, there is a patronage services available to ensure that pediatric care is available. But on childcare, I think we always need to prioritize it. And It's a multiple aspects to bring in, but particularly nutrition important, important vaccination, important to support on mental health. As the winter is coming, I think many of the health facilities are getting prepared. If I look at the health facilities, and many of those I have visited, with generators, heating, because it is highly likely that it will be a similar winter ahead of us, including challenges, not only with electricity, but also with the heating. And the facilities are taking care that they are prepared, but you can always do more. What is a challenge for people is exactly the transport, availability of medicines. So how to take care of your own health, or how to ensure that you reach to the facility when it's needed. And let me bring just an example. When I was in Kherson Oblast yesterday, the road that you usually drive 1 hour, when it is rain, when it is slight snow, it takes 3 hours. And that's something that we need to keep in mind, that the transport in the wintertime is much more difficult. So it's not only the health sector, but all the infrastructure around the roads, electricity, heating, water, that also makes it more difficult to have proper care in the right time. So as in the past winter, we are assessing also now that the chronic diseases will go up. As well, we will have potentially higher numbers of deaths because of the cold and freezing. And WHO has published also specific paper on the winter preparedness and main risks ahead, taking into account very specific information, oblast by oblast in Ukraine. And that is available also in our website to look where the main risks are as we are entering the winter. And many of the facilities, finally, the last point, have been preparing for the winter. This is something that I have witnessed also in the facilities, including the primary care and hospitals, and many of them beyond health sector. We see also many of the centers of resilience, where we have elderly doing a tea, charging their phone or radio to ensure that they have support available. But overall, Lisa, I think this year will not be easier than the last year.
Thank you very much. That was on that very realistic note. I think we can close. I'm looking in the room. No further questions. No further questions online. So thank you very much, Dr. Habicht, for that really comprehensive analysis of what's gone before, what we're looking at in the future. You mentioned a paper on winterization. I'll ask colleagues, I know they're listening in Ukraine, to please add that to the notes, the link to that, and any other links that would be useful for the journalists listening. And on that, I'll close this press release. Thank you very much. Oh, press conference. Anything else you'd like to add? Yeah.
Thank you, Margaret. And I ask everybody always, when we talk about Ukraine, please come to Ukraine. I think it's important that we see what is happening and how we can support. As well, from WHO side, we stay here available, and we have published in the past 6 months number of reports available on primary care financing, on health needs of people, situation across thousands of health facilities. So all the journalists and colleagues, please reach out, and the materials are available in our website. So that might be useful for your cause as well. But thank you, Margaret. Thank you all who joined. And I wish you a safe end of the year from one of the shelters in Odessa. Thank you.
Thank you, and wishing you a very safe time. Stay safe in Ukraine, Dr. Habicht.
Recording stopped.